We're back now with Dr. Ken Schiffman, who's a board-certified orthopedic surgeon with Hinsdale Orthopaedics, and he's on staff at Hinsdale Hospital and Good Samaritan Hospital in Downers Grove. Dr. Schiffman's known for his excellent work in shoulder injuries, and especially for rotator cuff surgery, which he does a lot of. We're discussing shoulder conditions right now. Dr. Schiffman, why is there such an increase in shoulder conditions today?
Lisa, we think there are a number of factors, probably the most significant being the high activity level of most of our population. Adults are simply more active in sports on a competitive basis, overhead sports in particular, tennis, swimming, the list goes on and on. So we have an active population, which is wonderful for general health, but we see more shoulder problems as a result. Another aspect of this, we believe, is increased keyboard use. And I don't only mean keyboard use at work, keyboard use during the course of our day at home, more laptop users than PC users, and the position that you've got to hold your arm in to use these keyboards puts more strain on the rotator cuff muscles and tendons.
What kind of activities are limited by shoulder problems?
Most of the patients who come in with shoulder complaints tell us about trouble at night. They turn at night, awaken from sleep, so that's a very common complaint. Other than that, it really is or are the activities that require us reaching our arm away from the plane of our body. So reaching up to a shelf, reaching behind to get the seat belt will be difficult because of these problems.
So what typical steps would you take with a patient when they come in?
Well, like most other problems that we treat, it's, the history really helps the most. And so patients describe the location of their pain, and that is really key, because the location of pain can really allow me to point at, whether it is the rotator cuff, that is the muscles and tendons that move the shoulder, whether it's a ligament injury, bone injury such as arthritis. So history is critically important. Then of course the physical examination, so asking patients to move their shoulder through a plane of motion when the pain occurs through that course of motion, and localized tenderness. So I push and touch, and where it hurts is significant. Beyond that, it's the diagnostic tests that we can get. And many patients will at least go through a simple battery of routine x-rays. Those x-rays allow us to rule out the gross bone problems such as arthritis, fractures if there's such a history. Beyond x-rays then, if needed, and it really is if needed, MRI is a diagnostic test that really has helped us a lot for shoulder diagnosis.
So if you had to give one tip, what's the first thing that any person with a shoulder injury or shoulder condition or shoulder pain should do?
Well, I think that particularly around the shoulder, when you experience pain, don't ignore it. Most of these shoulder problems can be helped by simple exercises and physical therapy, and it's more likely that we're going to get that to work when we catch it early.
So the first step would be to see a professional, see an orthopedic surgeon like yourself.
Yes.
And to come in here first, and then you'll be able to kind of map out a course for them.
That's right. And as I said, most patients will be sent off for exercises either on their own or with formal physical therapy. And in a lot of cases, we really can turn that around.
That's great, and I'm sure you have. Thank you so much, Dr. Schiffman, for discussing the increase in shoulder conditions today and what people can do about it, and it's important to see an orthopedic surgeon when you have a condition like that. Dr. Schiffman's a shoulder, elbow, and hand surgeon at Hinsdale Orthopaedics. You can book an appointment with him through the website, or you can call 630-455-7135 and talk to Marilyn. Thanks so much, Dr. Schiffman.
Thank you, Lisa.